Imagine paying, I don't know, 500 pounds or maybe even 1,000 just to walk into this luxury aesthetic clinic.
Right.
You're there for a highly anticipated cutting-edge treatment to fix a really deeply intimate problem. Maybe you've been dealing with a lack of sensation or actual physical pain during sex.
Which is incredibly distressing.
Exactly. So, you sit down, you pay the premium, only to find out that the needle the practitioner is about to use on you is, well, technically illegal.
Yeah, it's a shocking scenario. But honestly, it's exactly what is happening right now in clinics all across the country.
Which is wild.
It is. We're seeing this massive collision between, hyped up biotechnology and very rigid medical regulations.
Which brings us to our mission for today's deep dive. We are heading straight to the bleeding edge of regenerative medicine to answer a really specific question that you've been asking us to investigate.
And it's a great question.
Yeah, it really is. The question is, are exosomes more effective than platelet-rich plasma, commonly known as PRP, when it comes to improving clitoral sensitivity and treating sexual dysfunctions, like female sexual arousal disorder?
It's a fascinating topic, and honestly, it's completely dividing the aesthetic medicine community at this exact moment.
I can imagine. And to figure this out for you, we've pulled together just a massive stack of sources today.
We really did.
Yeah, we're looking at aesthetic pharmacy guides from Church Pharmacy, clinical overviews of non-surgical genital aesthetics from the International Society of Aesthetic Genital Surgery and Sexology.
Right, the ISEX.
Exactly. And some really detailed clinical research from the PMFA journal. But, we are also looking closely at the guardrails.
The less glamorous but incredibly important stuff.
Right. So safety warnings from UK regulators, like Save Face, medical malpractice guidelines from Enhance Insurance, and official NICE guidelines, that's the National Institute for Health and Care Excellence on vaginal treatments.
It is a heavy stack for sure, but a really vital one. Because you simply cannot look at the biological promise of these treatments without also looking at the strict regulatory reality of, how they are actually applying to your body.
And I think that's the core conflict of this deep dive, because on one hand, we have a biostimulator that is widely celebrated and marketed globally as the O-shot.
Right.
But on the other hand, we have this hyped next-generation treatment that promises a biological miracle, but might actually void a clinic's medical malpractice insurance the second it pierces your skin.
Yeah, it's quite the contrast.
Okay, let's unpack this.
So, to really understand if exosomes are the better option for something as complex as arousal dysfunction, we really have to start by establishing the baseline.
Makes sense.
We have to look at the current gold standard in regenerative sexual health treatments, which is PRP.
Right, platelet-rich plasma. And I understand that PRP is basically recycling my own blood.
Essentially, yes.
But practically speaking, what happens between drawing my blood and it becoming this powerful O-shot that everyone always talks about?
It's a great question. So PRP is what we call an autologous treatment.
Autologous, meaning it comes from me.
Exactly. It comes entirely from you. So a practitioner will draw a small vial of your blood, similar to like a standard blood test.
Okay.
And then they place that vial into a specialized centrifuge. They use systems like Salinas or DPG.
Right, the spinning machine.
Yes, exactly. The centrifuge's job is to spin the blood at a very specific calculated force.
Yeah.
And the goal there is to separate the red blood cells from the plasma.
Got it.
So what they pull out at the end is this golden liquid. Your plasma contains a massively high concentration of your own platelets.
Okay, so forgive me if this sounds basic, but platelets aren't just for scabbing over a cut, because when I think of platelets, I just think of, blood clotting.
Yeah, that is their most famous job, for sure.
Yeah.
But it's only half the story.
Oh, really?
Yeah, platelets are actually packed with vital proteins called growth factors. Think of growth factors as your body's first responders for tissue repair. So when this highly concentrated plasma is injected back into a specific area of the body, those growth factors are released in this massive wave.
Like an alarm going off.
Basically, yeah. They wake up local cells,
Yeah.
specifically targeting fibroblasts.
Oh, hold on. Let's define that. What exactly is a fibroblast doing for me?
A fibroblast is essentially a microscopic collagen factory. It's like the most common cell of connective tissue in animals.
Okay.
So the growth factors tell the fibroblasts to ramp up production of new collagen and elastin. But, crucially for sexual health, the growth factors also trigger a process called angiogenesis.
Angiogenesis. Okay, break that one down for us.
Sure. So angio means blood vessel, and genesis means creation.
Okay.
So you're literally triggering the body to build brand new networks of blood vessels from scratch.
Oh, wow. Okay, so when we look at the application of this in female sexual health, angiogenesis is obviously the star of the show
Absolutely.
because the PMFA journal notes that injecting PRP directly into the clitoris significantly improves sensitivity. And I mean, that makes perfect sense now.
Right.
By increasing that local blood flow network, you're directly addressing the physical roadblocks to arousal.
Exactly. Because female sexual arousal disorder, or FSAD, it often involves a physiological failure.
Like the body just not responding.
Right, a lack of adequate blood flow and tissue engorgement when stimulated. So delivering a concentrated dose of your own blood vessel building growth factors is a highly logical, really targeted treatment.
Which explains the mechanics behind the famous O-shot.
It does.
Because according to the ISAD guidelines in our stack, the O-shot involves applying this PRP injection to 3 main areas.
Yeah, the anterior vaginal wall, the vestibulum, and the paraclitoral areas.
Right, let's map that out for everyone. So the anterior vaginal wall is the front wall inside the vagina, often associated with the G-spot, I believe. And the vestibulum is essentially the entrance or opening. And paraclitoral just means the tissue immediately surrounding the clitoris.
Yes, exactly. And the explicit clinical goal here is to increase sexual pleasure, improve natural lubrication, and really importantly, increase the physical capacity for orgasm.
By rejuvenating that entire complex of erectile tissue.
Yes.
And since PRP uses the patient's own blood, I imagine the safety profile and regulatory acceptance are pretty strong compared to synthetic options. Like, your body isn't going to fight a war against its own plasma.
You've hit the nail on the head. I mean, PRP is a highly established regenerative treatment across multiple fields of medicine.
Like joints and stuff too, right?
Yeah, from orthopedics to hair restoration. And precisely because it is autologous, it's basically recycling your body's own natural healing system.
Right.
The Church Pharmacy Guide actually classifies PRP as providing a safe, moderate regenerative effect. It is a known, trusted entity.
Okay, a safe, moderate regenerative effect. That sounds great in theory, but I know that in the aesthetic and anti-aging world, moderate is basically an insult.
Oh, absolutely. Everyone always wants the next big leap.
Right. So if PRP is so safe and proven, why is everyone chasing the challenger? I mean, why is the industry so obsessed with moving past PRP to exosomes?
It comes down to a fundamental difference in how they operate at a cellular level.
Okay.
To understand the hype, you really have to understand the scale and the mechanism. First of all, exosomes are not cells.
They aren't.
No, they are microscopic extracellular vesicles. We are talking unimaginably small,
How small is unimaginably small?
like measuring between 30 to 150 nanometers.
Wow.
Yeah, just for context, a single red blood cells is about 7,000 nanometers wide.
Okay, so they are incredibly tiny. But what actually are they? I mean, if they aren't cells, are they like tiny biological text messages floating around the body?
That's a fun way to think about it, but a text message implies just a simple notification, right?
Yeah, like, hey, I'm here.
Exactly.
Yeah.
Think of it more like a software update, plugging into a computer and completely rewriting the operating system.
Whoa, okay.
Exosomes are naturally released by cells to communicate with other cells, but they carry incredibly complex, potent cargo.
What kind of cargo?
They carry specific proteins, lipids, and this genetic material called microRNAs.
MicroRNAs. How does that rewrite the operating system?
So when an exosome enters a damaged cell, that microRNA binds to the cell's messenger RNA. It can literally intercept instructions.
Wait, really? It intercepts them?
Yes. It can tell a cell to turn off the genes that cause chronic inflammation and simultaneously turn on the genes that accelerate rapid tissue repair.
That's amazing.
It is. While PRP relies on releasing a general flood of growth factors and just kind of hoping the local cells figure out what to do, exosomes are directly hacking the cellular machinery.
They're telling it exactly what to execute.
Exactly.
Okay, let me see if I have this straight. If PRP is like dropping off a giant pile of raw building materials at a construction site and hoping the crew eventually gets to work, right? Exosomes, like handing the workers the exact blueprints and a megaphone, telling them exactly where every brick goes.
That is a perfect analogy.
Okay.
You aren't just giving the body the fuel to heal. You are giving it the exact highly engineered instructions. What's fascinating here is that at a cellular level, exosomes mimic natural communication.
Right.
This is exactly why the Church Pharmacy Guide explicitly notes that while PRP offers a moderate effect, Exosomes provide a potentially stronger signaling cascade.
A stronger signaling cascade.
Yeah.
So if you are dealing with something deeply frustrating like clitoral numbness or an arousal disorder where, nerve regeneration and vascular repair are absolutely critical,
Mhm.
having the blueprints rather than just the raw materials sounds like a massive biological upgrade.
Theoretically, it is a massive upgrade. The potential for addressing the deeply physiological components of sexual dysfunction is profoundly exciting. I mean, if you can command the local genital tissue to regenerate its vascular and nerve networks with that level of precision calming inflammation while building new pathways, the clinical outcomes could theoretically far surpass what we see with a standard PRPO shot.
So the biology sounds vastly superior.
It does.
Why isn't every clinic tossing out their PRP centrifuges and switching to exosomes right now?
Because the biology is superior on a laboratory spreadsheet. But the reality of clinical application in human patients is a completely different story.
Ah. And this is where our deep dive takes a really sharp turn. Because if we look at the reality of walking into a clinic today, we aren't stepping into a biological utopia. We are stepping into a legal and safety minefield.
We absolutely are.
Right.
To understand why clinics aren't just tossing out their centrifuges, we have to look closely at the urgent warnings published by SaveFace.
That's the National Register of Accredited Practitioners in the UK, right?
Yes, exactly. And we also have to look at the strict guidance from Enhanced Insurance, which covers medical malpractice for these exact clinics.
Okay, what do they say?
In the UK, injecting exosomes, whether you are doing it intradermally into the skin, subcutaneously into the fat, or intravenously, is strictly prohibited.
Wait, really?
Yes.
Wait, so if a listener sees a clinic offering injected exosomes for clitoral sensitivity or advertising an exosome O shot, they aren't just getting an unproven treatment, they are getting an illegal one.
That is exactly right. It completely lacks authorization from the Medicines and Healthcare Products Regulatory Agency, the MHRA.
Wow.
If a needle is being used to deliver exosomes beneath the skin in the UK right now, it is an unregulated, illegal cosmetic procedure.
But I'm confused. I mean, I see exosome facials and exosome hair serums advertised all the time by seemingly reputable places.
Yeah, you do.
How can those be perfectly legal if the injections aren't?
Well, it comes down to two crucial factors. First, the biological source of the exosomes, and second, the method of delivery.
Okay, let's break that down.
Sure. So plant-derived exosomes or animal-derived exosomes like those extracted from bovine colostrum, which is basically cow's milk.
Yeah.
Those are perfectly legal in the UK, but only if they are applied topically.
Topically meaning just rubbed on the surface.
Yes. So a practitioner can use a microneedling device to create tiny channels on the surface of your skin and then rub a plant-derived exosome serum over the top to aid healing.
Okay, I've seen that.
Right. That is legally classified as a cosmetic topical application.
Okay, but to regenerate clitoral tissue or to treat deep vaginal arousal issues, a topical plant serum rubbed on the surface isn't going to cut it.
Not at all.
You need something that integrates deeply with human vascular tissue.
Right, which brings us to human-derived exosomes.
Ah.
To get that deep, powerful signaling cascade we talked about, these need to be extracted from human donor tissue,
Like what?
often umbilical cord lining or placental tissue.
Oh, wow.
And currently, human-derived exosomes are not approved for cosmetic use in the UK or the EU, period.
I assume that's because introducing foreign human material into someone's genitals carries a massive risk profile.
Precisely. When you introduce human-derived exosomes for an unknown donor into a patient, you're introducing foreign molecules.
Right.
Even though exosomes don't have a nucleus like a full cell does, there is still a very real risk of triggering a severe immune response.
This is not yours.
Exactly. Your body might recognize the blueprints, but it also recognizes that they came from an intruder.
That sounds dangerous.
It can be. Not to mention the inherent risks of viral contamination or bacterial infection during the manufacturing process if it isn't strictly regulated as a high-tier medicinal product.
Which the MHRA explicitly considers them to be.
Yes.
They consider injected exosomes to be medicinal products, meaning they need rigorous, multi-year clinical trials and authorizations that, simply do not exist for these cosmetic or sexual health applications yet.
If we connect this to the bigger picture, we are looking at a profound dilemma in the aesthetic industry.
How so?
Well, you have this next-gen science that sounds miraculous, and patients are desperate for solutions to intimate, highly distressing problems like sexual dysfunction. And you have practitioners willing to push the boundaries ahead of regulatory safety frameworks just to meet that demand.
And charge a massive premium for it. I mean, the Safe Face report notes patients are paying £500 or more per session for this luxury exosome upgrade.
Oh, easily.
But if a UK clinic is injecting these for sexual dysfunction, they are voiding their medical malpractice insurance.
Completely voiding it. They are operating entirely outside the safety net.
Wow.
Enhanced insurance makes it very clear in their guidelines. Using unregulated products or using them outside their legal topical application completely invalidates the clinic's cover.
So you're on your own.
Basically,
Yeah.
if you have an adverse immune reaction to an illegal exosome injection in your clitoris, you have zero insurance protection, and the practitioner is entirely exposed legally.
That is a staggering risk for a quote-unquote potentially stronger signaling cascade.
It really is.
Okay, so if chemical messengers like exosomes are legally and safely off the table for deep tissue injection,
Right.
how else can we trigger that exact same collagen and blood vessel response without injecting a foreign biological body?
Good question.
Like, if you are dealing with painful sex dyspareunia or arousal dysfunction and you want options beyond the PRPO shot, what else is medically validated?
Well, that forces us to look away from injectables entirely. We have to look at physical triggers.
Okay.
The other major category of medically validated treatment is device-based, specifically transvaginal laser therapy.
Right, and we have the official NICE guidelines overviewing this exact treatment.
We do. The NICE guidelines look extensively at the use of CO2 and erbium.YAG lasers for urogenital conditions.
Okay, so how does a laser help with this?
Well, unlike biostimulators like PRP or exosomes, which use biological materials to signal healing,
Yeah.
lasers use controlled thermal injury.
Control thermal injury. That sounds intense. You are literally using a laser to burn the tissue.
It sounds totally counterintuitive, I know, but it's a proven mechanism.
Okay.
A laser probe is inserted into the vagina, and it emits heat energy in a microscopic grid pattern. It creates tiny controlled microwounds in the tissue while leaving the tissue around those dots completely untouched.
Why would you want to wound the tissue?
Because the body's natural response to this targeted thermal injury is an over-repair mechanism.
Oh, I see.
It rushes in to clear away the damaged tissue, remodel the entire area, and lay down thick, highly organized type I collagen.
So it's essentially tricking your body into rejuvenating the vaginal lining by deliberately injuring it first.
Exactly.
And the data on this is actually pretty robust, isn't it?
It is very robust.
Yeah.
The NICE overview aggregates several systematic reviews. They use a standardized metric called the Female Sexual Function Index, or FSFI.
Right. Which covers desire, arousal, lubrication, orgasm, and satisfaction.
Exactly. And across the board, they note significant measurable improvements in the FSFI following a course of laser therapy.
Wow. The NICE data also points out massive reductions in dyspareunia or painful sex.
Yeah.
They measured a pooled mean difference, showing a reduction of 5.6 points on a visual analog scale for pain.
Which is huge.
Just to translate that for you, on a standard 1 to 10 pain scale, this laser therapy is literally cutting patients' pain in half.
It's incredible.
That is a life-altering relief for someone experiencing severe agony during intercourse.
It absolutely is.
Yeah.
However, if we are maintaining our scientific rigor here, we cannot just look at the successes.
Fair enough.
Device-based treatments are entirely legal, they are MHRA and CE approved, and they are widely used, but they are not without significant risk.
Yeah, I have to admit, reading the Gordon C. case series highlighted in the NICE report was genuinely tough.
It is really sobering reading.
Yeah.
It detailed cases of patients who experienced severe adverse events after this exact laser therapy. Let's look at the mechanics of what went wrong.
Okay.
One 61-year-old patient who had mild dyspareunia before the laser treatment ended up with progressively worse pain, severe vaginal dryness, and a condition called pelvic floor hypertonus.
Let's explain that term. The levator ani and the pelvic floor. That's essentially the vital hammock of muscle that supports all your pelvic organs, right?
Correct. And hypertonus means those muscles went into a state of chronic, agonizing spasm.
Oh, no.
Yeah. Because of the thermal injury from the laser, her body's repair response misfired, leading to severe muscular tension.
That's awful. And there was another one, a 55-year-old patient who experienced such severe tissue scarring and spasms after 3 laser treatments that she actually required the use of vaginal dilators.
Right. Physical cylinders used to stretch the tissue.
just to manage the resulting pain.
Exactly.
Here's where it gets really interesting, though.
Oh.
Yeah, we have cutting-edge exosomes, which are incredibly promising biologically, but they are illegal to inject because regulators deem the foreign donor material too risky.
Right.
And then we have lasers, which literally burn your most sensitive tissue to heal it, that are completely legal and widely approved, but can occasionally cause the exact agonizing pain and scarring they are meant to cure.
It's a powerful observation. It really forces us to think critically about how we define safe in medicine.
Yeah, it does.
While laser therapy has strong aggregate data showing it works beautifully for the vast majority of women, every single physical medical intervention carries risk.
Of course.
You always have to weigh the broad clinical evidence against your own specific risk tolerance and medical history.
So what does this all mean? Let's bring this all together. We started with a highly specific question. Are exosomes more effective than PRP for clitoral sensitivity and arousal dysfunction?
Well, based purely on the cellular science, exosomes boast a potentially stronger signaling cascade than PRP.
Okay.
Because they act as direct cellular messengers that can rewrite how a cell behaves, they are highly promising on paper for deeply physiological issues like female sexual arousal disorder.
But based on reality?
Based on clinical reality,
Oh.
PRP, the traditional O-shot, remains the clear, established, and legal winner for injection-based treatments today. It has a deeply proven safety profile because it uses your own blood, it effectively stimulates the vital blood flow and tissue repair you need, and it is entirely legal for a qualified practitioner to perform.
Which is the most important part.
Exactly. Exosome injections, conversely, remain illegal, unregulated, and fundamentally risky in the UK.
And for you, as someone who wants to be fully informed about your own health, this means you have to look past the glossy clinic marketing.
Please do.
When your social media feed starts promising scarless healing or next-gen sexual rejuvenation with exosomes, you have to ask the tough questions.
Always ask questions.
You have to ask your practitioner about biological sourcing. Are these human donor cells or plant-based? You have to ask about regulation. And you have to ask about the actual legal status of the needle they are holding in their hand.
Absolutely.
Because new does not automatically mean better, and it certainly doesn't always mean safe.
This raises an important question about the future, though, because this science is not standing still.
Oh, where is it heading?
Well, right now, the major biological and legal hurdle with exosomes is that they are derived from donors. That foreign material is what triggers the regulatory bans and the immune system alarms.
Right.
But what if we could remove the donor entirely?
Wait, how would that work?
What if, in the near future, we perfect the technology to extract and produce personalized exosomes?
Oh, wow.
Imagine a scenario where a clinic takes a sample of your own cells, isolates your own unique exosomes, multiplies them in a lab, and then injects your bespoke autologous exosome therapy back into your body.
That would be incredible.
Right. Could creating a customized treatment like that finally combine the undeniable legal safety of PRP with the biological superpower of exosomes, completely revolutionizing how we treat sexual dysfunction forever?
I guess we'll just have to wait and see.